It's 7:15. Along with facing new challenges like working from home or not being able to see loved ones, many people have experienced feelings of boredom, anxiety, maybe turned to alcohol to help manage those feelings. Much like Dry July, Sober October encourages people to reduce or maybe abstain entirely from alcohol for 31 days. Touro's family medicine physician, Dr. Schuyler Williams, joins us to talk about the impact of alcohol, which is sometimes ignored. Dr. Williams, good morning to you. There are actually recommended health guidelines when it comes to alcohol. What are they?
Yeah, good morning. To reduce the risk of harm related to alcohol use and disease and injury, women of legal drinking age are recommended to consume no more than one alcoholic beverage per day, and men of legal drinking age are recommended to drink no more than two beverages in a day.
And then some people might be surprised by what binge drinking. You think of college students just drinking enormous amounts of alcohol, but what exactly is binge drinking? How is that defined?
Binge drinking is drinking in excess, and for women, that's considered having more than four alcoholic beverages in one setting. And for men, that's having more than five alcoholic beverages in one setting, which, as you mentioned, is fairly common when people are getting together to celebrate. But that's technically considered drinking in excess.
Everybody realizes kind of the short-term risk of injury, the miscarriage, I guess, is an issue for women. Let's talk, though, about some of the research when it comes to long-term risk. What are the long-term risks of drinking too much alcohol repeatedly?
Yeah, long-term risks include development of many chronic diseases and ailments such as cancer, dementia, liver disease, and even high blood pressure. Excessive alcohol use has also been linked to worsening mental health. It can increase your chances of developing anxiety or depression. So there's a lot of long-term risks associated with drinking large amounts of alcohol.
And we've done any number of stories over the years on doctors do some study which suggests that one drink of red wine, say, 5 times a week or something like that, has health benefits. But there is actually some research recently suggesting that no amount of alcohol is good for you.
Yeah, there's new research emerging showing that alcohol, even in smaller amounts, can have impacts to your health. We know definitely that reduced alcohol consumption promotes people getting a better night's sleep, which leads to higher energy levels and improves concentration. We know those are definitely things that we see with people who drink less alcohol. Important things to keep in mind. And I think it's important to know that if you're thinking about cutting back on alcohol use, this is a tough thing to do on your own. So it's important to reach out to your friends and family for support, but also your doctor to talk about what are safe strategies to cut back on alcohol.
All right. Moderation, I guess, is key, as with all things. Dr. Schuyler Williams, thanks so much, as always.
Thank you for having me.